All right, get ready for this deep dive.
Yeah.
Because we're going somewhere most of us have been before, but
Yeah.
we've never really seen the world of the respiratory exam. You know, the one your doctor does,
Right.
not the one you might be dreading in med school.
Yeah. So we've got the ultimate guide for this deep dive.
Okay.
Actual instructions for medical students learning this very exam.
Which, let me tell you,
Yeah.
is way more fascinating than I expected. I mean, we all know the drill deep breaths.
Uh-huh.
The doc listens to your back. But there's a whole detective story happening here.
Oh, yeah.
Starting before they even lay a finger on you.
Absolutely. Doctors are already gathering clues just by observing you, things like how you're breathing,
Oh, wow.
your skin color even, whether you've got a pack of cigarettes
Oh, interesting.
or an oxygen tank nearby, it all paints a picture.
Okay, that makes sense, setting the scene and all that. But then the guide jumps right into examining the hands.
Yeah.
I never would have thought.
Yeah, the hands are surprisingly revealing when it comes to respiratory health. Take clubbing, for example.
Okay.
It's this weird thickening and widening of the fingertips.
Right.
And it can actually be a sign of chronic lung disease.
Oh,
It's almost like the body's trying to compensate for low oxygen levels by increasing blood flow to the fingertips.
So our bodies are sneakily sending signals all the time.
They are.
What else are they looking for in those hands?
Well, they also check for something called palmar erythema,
Palmar erythema.
which is basically redness on the palms.
Okay.
It can be caused by a bunch of things,
Right.
but in the context of a respiratory exam,
Yeah.
it might point towards liver problems,
Hmm.
which, believe it or not,
Yeah.
can impact breathing, too.
It's all connected, huh?
It is.
So first impressions matter.
Uh-huh.
Then it's down to the details of the hands. What comes next?
The eyes and mouth are up next.
Okay.
They might seem unrelated to breathing, but they offer quick clues about oxygen circulation.
Hmm.
For example, pallor.
Pallor.
That paleness we sometimes see can indicate poor oxygen flow.
So even something as simple as looking in your mouth is a way to check how well your body is getting that sweet, sweet oxygen.
Exactly. And then things get a little more hands-on.
Okay.
Literally, we move down to the neck.
The neck.
I know. What does your neck have to do with breathing?
Yeah.
But there are some key insights lurking there.
You're telling me this is where they check the JVP, right? Jugular venous pressure,
Yes.
and it involves pressing on the abdomen.
Mm-hmm.
I'm not sure how comfortable I'd be with that.
It's actually not as bad as it sounds. I promise what they're doing is observing
Right.
how the pressure in the jugular vein, that's the one running down your neck,
Right.
changes when pressure is applied to your abdomen.
Why all the pressure, though? What's that got to do with my lungs?
Think of it like this. The JVP can tell us about the pressure on the right side of your heart.
Hmm.
And if that pressure is too high, it can impact how well your heart pumps blood to your lungs, which obviously affects your breathing.
So it's like a chain reaction. If one part of the system is out of whack, it throws everything off.
Exactly. And that brings us to what most people think of when they picture a respiratory exam.
Yeah.
The chest.
The main
exam.
event.
Yeah.
But even that's more involved than just a quick listen, right?
Oh, absolutely. They're checking chest expansion,
Okay.
tapping on your back. That's the percussion part.
Right.
And of course, listening with the stethoscope. But there are so many subtleties to each step.
Okay, like what
Yeah.
spill the tea? What are those subtle details telling them?
We'll take percussion, for example.
Yeah.
You know that tapping thing doctors do?
Uh-huh.
It's not random at all. They're listening for the sounds the tapping creates,
Okay.
which can actually tell them about the density of the tissue underneath.
So they're like human sonar mapping out your insides with sound.
Exactly. A hollow sound means air-filled lungs, which is good.
Okay.
But a duller sound might mean there's fluid buildup or something called consolidation,
Consolidation.
which basically means the lung tissue is denser than it should be.
Wait, so all that info just from tapping? That's pretty wild.
It is.
And what about the stethoscope part? It can't just be about listening for breathing sounds.
Right. It's more like they're listening for anything out of the ordinary.
Like what?
Wheezing, crackling, gurgling, things
Uh-huh.
like that. Those sounds can be clues to airway narrowing, fluid in the lungs, or even other issues.
I bet a lot of those sounds would make me panic if I heard them in my own chest.
Well, that's why they're the experts.
Right.
They know what to listen for and what it means. Plus, there's another interesting detail in the guide.
Oh, what's that?
The guide specifically instructs patients to say 99 during the exam.
99? Why on earth 99? What's so special about that number?
It's not about the number itself, but the vibrations it creates when you say it.
Okay.
Those vibrations travel through the lung tissue,
Uh,
and the doctor can use that to get a sense of how well sound is transmitting through your lungs.
so in a way, it's like using your voice as another diagnostic tool.
Exactly.
Okay, so we've covered the hands, eyes, mouth, and even had a little neck massage.
Yeah.
What other surprises does this respiratory exam have in store?
Well, before we move on completely from the neck area,
Okay.
there are a couple more things the guide highlights. The trachea, for instance.
The trachea, the
Yeah.
windpipe.
Yeah.
What could they possibly glean from that?
Doctors check to see if it's in the right place. If it's deviated or shifted to one side, that can actually signal a problem like a tumor
Oh,
or an enlarged thyroid gland. It can even be a sign of a collapsed lung.
wow. Talk about a red flag. So they're literally feeling around to see if your windpipe is where it's supposed to be.
Right.
Makes you appreciate their attention to detail.
Absolutely. And while they're in the neck area, they're also checking the lymph nodes above the collarbone,
Okay.
the supraclavicular lymph nodes.
Okay. Now, those I know can be a sign of illness if they're swollen. But what do those have to do with breathing?
It's all about patterns, remember. Swollen lymph nodes in that area can sometimes be a sign of a respiratory infection, or even certain types of cancer that can affect the lungs.
So they're not just looking at the lungs in isolation, but how they fit into the bigger picture of the body.
Exactly. And that bigger picture brings us back to the chest exam, where things get really interesting.
We talked about the tapping and listening, but what about chest expansion? What are they looking for there?
Remember how we talked about the doctor placing their hands on your chest and asking you to take a deep breath?
Mm-hmm.
Well, they're not just checking if your chest moves, but how it moves.
Okay, so more than just in and out. What else is there to see?
They're paying close attention to symmetry. They want to make sure both sides of your chest are expanding equally. If one side lags behind it, could mean there's a problem with that lung, or even a restriction in the chest wall itself.
So again, looking for those subtle imbalances that could point to a bigger issue.
Precisely. And then we're back to percussion. This time they're focusing on your back.
To get at those hard-to-reach spots.
Exactly. Percussion on the back allows the doctor to assess the lower lobes of the lungs, which can be tricky to examine from the front. They're listening for those subtle changes in resonance. Remember the hollow versus dull sounds, to get a sense of what's happening deep inside.
It's like they're piecing together a sonic puzzle of your lungs.
Oh.
And, of course, after the tapping comes the listening with the stethoscope again, right?
Yes, but again, they're listening with intention. They're not just listening for the presence of breath sounds,
Okay.
but also for their quality volume and any additional sounds that might be present.
I imagine a lot of people might feel self-conscious about being examined so closely, especially when it comes to their back.
Well, there's actually a really interesting point in the guide about that.
Oh, is there?
It specifically mentions that unless otherwise advised by the examiner, the patient should be examined topless.
Topless.
Yeah.
You're kidding. Why on earth would they need... Oh, wait. Clothing would get in the way.
Exactly. Clothing can muffle sounds, hide subtle skin discoloration, and make it harder to assess things like chest expansion accurately.
I guess when it comes to your health, it's better to be safe than sorry, right? No point in letting a little modesty obscure a potentially important finding.
Precisely. It underscores the importance of a thorough examination. Every detail matters.
So we've covered a lot of ground here. From hands and eyes to necks and chests and even a little bit of back exposure. What else stands out to you about this respiratory exam?
So we've gone on this journey from head to toe,
Yeah. uncovering
all these hidden clues that doctors are looking for during a respiratory exam. But I'm realizing we focused on what they're looking for, those red flags, the sounds, the swelling.
Right.
What about where are there specific landmarks on the body they're paying extra attention to?
That's a great observation, and you're absolutely right.
Okay.
The guide is very specific about the areas they examine, especially when it comes to the chest. It's not just random tapping and listening.
Okay, so walk me through it. Where are they focusing their attention during the percussion part of the exam?
They actually follow a pretty systematic pattern. They start with the clavicles, those bones at the top of your chest.
Right. And then work their way down, comparing each side as they go.
Okay.
Then they repeat the process on the back.
So it's almost like they're creating a grid, making sure they cover every inch of lung territory.
Exactly.
Yeah.
And the same goes for auscultation.
Auscultation.
The listening part. They
Yeah.
use the diaphragm of the stethoscope, the flat part,
Yeah.
and listen along specific lines on the chest, both front and back.
There are specific lines I'm picturing my chest with dotted lines all over it.
Yeah.
Some kind of medical treasure map.
Uh-huh.
What are these magical lines? What makes them so special?
They correspond to the lobes of your lungs.
Okay.
By listening along these lines,
Yeah,
the midclavicular and anterior axillary lines,
got it.
doctors can isolate sounds coming from different parts of the lungs.
Oh,
It's like pinpointing the source of a sound in a symphony orchestra.
so they're essentially mapping the lungs with sound, figuring out which section might be playing a sour note. This is incredible.
It really is. And there's another detail that surprised me.
Oh, really?
What's that? The guide actually cautions doctors against listening too centrally on the chest.
Hmm.
Apparently, that can be misleading because of sounds coming from the heart and other structures in the middle of the chest.
So it's about finding the sweet spot for lung sounds not too close to the heart, but right over the lobes themselves.
Exactly. It's all about precision and isolating those specific sounds.
Okay, last question before we wrap this up. I noticed the guide mentioned something about checking for scars on the back. What's the significance of that?
Scars, especially on the chest, can tell a story about someone's respiratory history.
Okay.
They might indicate past surgeries, injuries, or even infections that could have affected the lungs.
It's like each scar is a chapter in the story of your lung.
Exactly. And by piecing together all these clues,
Right.
the observations, the sounds, even the scars, doctors can get a comprehensive picture of your respiratory health.
This whole deep dive has been a revelation.
Yeah.
I feel like I can actually understand what's happening during a respiratory exam now, not just
Yeah.
endure it.
That's what we're here for, to demystify the medical world and empower you with knowledge.
Mission accomplished. So to wrap things up, what's the key takeaway you want our listeners to walk away with?
The biggest takeaway is that a respiratory exam is so much more than just listening to your lungs.
Right.
It's a meticulous, multifaceted investigation that takes into account a wide range of observations.
Yeah.
Everything from the color of your skin to the position of your trachea to the
Wow.
sounds your chest makes plays a role.
And it really highlights the interconnectedness of your respiratory system with other vital organs, especially the heart.
Absolutely. So the next time you're at the doctor's office, don't just zone out during the exam. Pay attention, ask questions.
Yeah.
And you'll be amazed by how much you can learn about your own body.
Such great advice. That's all the time we have for today. Thanks for joining us on this fascinating deep dive into the world of respiratory exams.
Until next time, keep exploring, keep learning, and keep breathing.